Cholecyst. The gallbladder, a small organ under the liver, stores bile to help digest fats. It releases bile into the small intestine when needed. Issues like gallstones or inflammation can cause pain and require treatment, sometimes including surgical removal, cholecystectomy. Colon. The large intestine's main section absorbs water and salts from digested food, forming stool. It plays a key role in waste elimination. Conditions like colitis, diverticulitis, and cancer can affect it, sometimes requiring procedures like colonoscopy or surgery. Duodenum, the first section of the small intestine, connecting the stomach to the jejunum. It receives partially digested food, chyme, bile from the liver, and digestive enzymes from the pancreas to aid in nutrient absorption. Common issues include ulcers and blockages. Esophagus, a muscular tube that transports food and liquids from the throat to the stomach. It uses peristalsis, wave-like contractions, to push food downward. Conditions like acid reflux, GERD, and esophageal cancer can affect its function, sometimes requiring medical treatment. Stomach, a muscular organ that digests food using stomach acid and enzymes. It churns food into a semi-liquid form before passing it into the small intestine. Conditions like ulcers, gastritis, and acid reflux can affect stomach function and digestion. Liver, a vital organ that processes nutrients, detoxifies harmful substances, produces bile for digestion, and regulates metabolism. It plays a crucial role in filtering blood. Diseases like cirrhosis, hepatitis, and liver failure can severely impact health and require medical attention. Ileum, the final section of the small intestine, connecting to the large intestine. It absorbs nutrients, especially vitamin B12 and bile salts. Conditions like Crohn's disease and blockages can affect its function, leading to digestive and nutrient absorption issues. Jejunum, the middle portion of the small intestine, between the duodenum and ileum. It is responsible for absorbing most nutrients, including sugars, amino acids, and fatty acids. Disorders like malabsorption syndromes or Crohn's disease can interfere with its function. Pancreas, a glandular organ behind the stomach that produces digestive enzymes and hormones like insulin. It plays a crucial role in digestion and blood sugar regulation. Conditions like pancreatitis, diabetes, and pancreatic cancer can severely impact its function. Pharynx, a muscular passageway at the back of the throat that connects the nose, mouth, and esophagus. It plays a role in swallowing and breathing. Infections, pharyngitis, tonsillitis, and throat cancer can affect it, sometimes causing pain or difficulty swallowing. Rectum, the final section of the large intestine, storing and controlling the release of stool. It plays a key role in bowel movements. Conditions like hemorrhoids, rectal cancer, and prolapse can affect it, sometimes requiring medical intervention. Gallstones, hardened deposits of bile components that form in the gallbladder. They can block bile flow, causing pain, nausea, and digestive issues. Treatment includes dietary changes, medication, or gallbladder removal, cholecystectomy, if severe symptoms occur. Cirrhosis, a chronic liver disease where healthy liver tissue is replaced by scar tissue, impairing function. Causes include alcohol abuse, hepatitis, and fatty liver disease. Symptoms include jaundice, swelling, and fatigue. It can lead to liver failure if untreated. Polyposis, the development of multiple polyps in the colon or other organs. While usually benign, some polyps can turn cancerous over time. Colonoscopy is used to detect and remove them, reducing the risk of colorectal cancer. Diverticula, small pouches that form in the wall of the colon, often due to pressure from straining. They may cause no symptoms, but when inflamed, diverticulitis, they can lead to pain, fever, and digestive issues. Treatment includes diet changes or, in severe cases, surgery. Hepatitis, inflammation of the liver, often caused by viral infections, hepatitis A, B, or C, alcohol, or toxins. Symptoms include jaundice, fatigue, and nausea. Chronic cases can lead to liver damage, cirrhosis, or liver failure if untreated. Jaundice, a condition where the skin and eyes turn yellow due to excess bilirubin in the blood, often caused by liver disease, bile duct obstruction, or hemolysis. It indicates underlying health issues requiring medical evaluation and treatment. Endoscopy, a medical procedure using a flexible tube with a camera to examine the digestive tract. It helps diagnose conditions like ulcers, inflammation, and tumors. It's commonly used for the esophagus, stomach, and intestines. Colostomy, a surgical procedure where a part of the colon is diverted to an opening in the abdomen, stoma, to allow waste to exit the body. It is used for conditions like colon cancer, bowel obstruction, or severe colitis. Laparoscope, a thin, flexible instrument with a camera used in minimally invasive surgeries. It allows surgeons to view and operate inside the abdomen through small incisions. Laparoscopic procedures result in faster recovery and less scarring. Appendectomy, a surgical procedure to remove the appendix, usually due to appendicitis, an infection causing pain and swelling. It is a common emergency surgery performed to prevent complications like rupture and peritonitis.